All right, let's play detective for a bit. Today we are on the case of a mystery that affects millions of people but is, often totally misunderstood. I'm talking about those itchy, persistent, and sometimes ring-shaped rashes. Together we're going to follow the clues, we're going to identify the culprit, and we'll learn how to close the case for good.
So, does this look familiar? It's that super frustrating rash that seems to pop up out of absolutely nowhere on your arm, your foot, maybe even your scalp. Well, if you've had it, you are definitely not alone. Our investigation today is all about figuring out exactly what this is and what's really behind it.
Every good mystery has a culprit, and in our case, it's this tiny microscopic organism with a very, very particular appetite. So it's time to meet the fungus that's causing all this trouble.
And here it is, our prime suspect. The official name is a bit of a mouthful, a dermatophyte. Now, the key clue to its entire operation is right there in the definition. It requires keratin for growth. So what's keratin? It's that tough protein that makes up our hair, the outer layer of our skin, and our nails. And this explains everything. The fungus only appears in these places because it's literally eating the building blocks of our skin and hair. It has zero interest in any other part of your body, which is why these infections stay on the surface and don't become some kind of deeper illness.
So how does this little guy get around? Well, it is a master of transmission. It can spread directly from other people, from animals like your pets, or even from the soil. And it can also hang around on inanimate objects called fomites. We're talking shared hairbrushes, hats, gym mats, or locker room floors. It is remarkably easy to come into contact with this stuff. Now that we know our culprit's name and its methods, let's look at the crime scenes. The official name for the infection is tinea, but here's the fun part. It gets a different last name depending on where it shows up on the body. Let's take a look at the usual suspects. Okay, our first crime scene is the scalp. This is tinea capitis, or scalp ringworm. This is the most common one in children, usually popping up between the ages of 3 and 7. It causes these flaky, scaly patches, and sometimes even a little bit of hair loss, which, as you can imagine, can be really distressing for both the parents and the kids. Next up is the one most people recognize, tinea corporis. This is that classic ringworm you might see on your body. It creates that characteristic ring-shaped, reddish, scaly rash. And this fungus absolutely loves hot, humid weather, which is why you see it so much more in tropical climates or during those sweaty summer months. Now, let's just take a second to talk about how incredibly common these infections are. The numbers are kind of staggering. Tinea pedis, which is just athlete's foot, can affect up to 70% of adults at some point in their lives. And onychomycosis, or nail fungus, is so widespread it accounts for half of all nail diseases. So yeah, these aren't rare conditions. They are incredibly prevalent. And finally, we have Tinea cruris, which most of us just know by its nickname, jock itch. And, well, as the name suggests, it affects the groin area and is most common in adolescent and adult men, especially athletes, because of all the friction and moisture down there. Okay, so we've seen the lineup of usual suspects, but in any good investigation, you have to rule out the imposters, right? How can we be sure we're dealing with a dermatophyte and not some other skin condition? We need to look for the telltale clues. This quote right here gives us our smoking gun. There are two dead giveaways for a fungal rash. First, what's called the active border. The very edge of the rash is inflamed and scaly, almost like an advancing front line. And second, there's often central clearing, which means the skin in the middle of the ring actually starts to look normal again as the fungus expands outward. This comparison just makes it crystal clear. On the left, you see Tinea corporis with its active edge and that clearing in the center. But now, look at a common lookalike like psoriasis on the right. The inflammation and scaling are just uniform across the entire patch. There's no central clearing at all. This visual difference is absolutely key for a doctor trying to make a diagnosis. But to be 100% sure, especially in tricky cases, doctors bring in the forensic tools. This is basically the lab work of our investigation. They might examine a little skin scraping under a microscope or even grow a fungal culture to get a positive ID on the exact species. They can even use a special magnifying tool to spot telltale signs like comma hairs in a case of scalp ringworm. So we've identified the culprit, we've confirmed its presence. Now it's time to bring in the reinforcements and talk about treatment. How do we fight this fungus effectively? The battle plan really comes in two main forms.
For infections that are just on the surface of the skin, like on the body, feet, or groin, topical antifungal creams that you apply directly on the rash work great. But for infections that have invaded the hair shaft or are deep within the nail, well, creams just can't penetrate that deep. That's when you need systemic pills that work from the inside out.
Let's look at a specific case file, scalp ringworm. First, pills are absolutely essential because the fungus is hiding down inside the hair shaft where creams can't reach. Second, the treatment is a real commitment, often lasting several weeks. And third, while the pills are fighting the internal infection, antifungal shampoos are used to cut down the risk of spreading it to other people. Now, for our toughest case. What do you think this number represents? This is the clinical cure rate for onychomycosis, or nail fungus, even with oral medications. It's a surprisingly stubborn foe. And the reason it's so difficult is actually pretty simple. Our nails grow incredibly slowly. To completely wipe out the fungus, you have to keep taking the treatment until the entire infected nail has grown out and been replaced by a healthy nail. And for a toenail, this can mean taking medication for 12 weeks or even longer. Okay. We have solved the mystery, and we've learned how to treat it. But the best strategy is always prevention, right? So let's finish up by looking at some simple steps you can take to keep this culprit from striking in the first place. Here is your prevention checklist. The main theme here is that fungi love moisture, so the key is to stay dry. Dry your skin really well after washing, especially between your toes. Wear flip-flops in public showers, locker rooms, and pool areas. Don't share personal stuff like combs, brushes, or towels. Wear loose, breathable clothing in hot weather, and maybe alternate your shoes every day to let them dry out completely. These small habits make a huge difference. So while we've talked about some of the really tough cases like nail fungus, I want to end our investigation on this really reassuring note. For the vast majority of common fungal skin infections, the outcome is excellent. They are highly treatable, and people make a full recovery. And case closed. You know the culprit, you know its methods, and you know how to stop it. So my final question to you is this. What's one small change you're going to make, starting today, to protect your skin? Thanks for joining me for this explainer.